bit about what it means to connect the dots and, how mental health is part of overall health and how DCPAP can really help uh, physicians, assistants, and everyone really work together as a team for overall health. So Dr. Bohr, can you kind of tell us just overall, how is mental health part of our overall health?
Thanks for asking, Jen. Mental health is important, not just for a sense of emotional well-being in kids and in families, but our mental health really affects our physical health and vice versa. So we find that if we can treat both together, that it can make a big difference in terms of early recovery, less lost school days, less lost work days for parents, and it helps people just have a better life. So what we find, I'd just like to give one quick example, is that when kids get depressed, their brain actually produces less of something called brain-derived neurotrophic factor, and that's a long-term for something in the brain that helps the brain grow and the body grow. So to have normal health, we want to treat depression, we want to treat anxiety, and we want to treat other issues that kids may present with.
That's awesome. I love the power of science and just explaining those little intricacies. It's so inspiring. So kind of segueing into that, can you kind of talk about just the power of working together as a team in healthcare and how DCPAP can really empower providers, on their healthcare journey?
Well, for a long time, primary care practices have already had teams within their primary care offices. They have physicians, physician assistants, nurse practitioners, counselors, sometimes embedded counselors. They have nurses, they have other staff helping them, and I probably left some people out, but they already are used to a team. And so when they consult for mental health, they like to have access to a full mental health team as well. And so our child psychiatry access program, even though it's a contact with a child psychiatrist, through the consultation and through some of the other resources that are available, we help people also make contact with a psychologist, a social worker, a school social worker, professional, and other teams or specific facilities that might have specific ways to help that one child. So it really brings teams together, and our real hope for the future is that it opens the door for more collaborative care, which is where I think our country is moving, both in terms of care delivery and care payment.
Awesome. Yeah, that would be wonderful. And what would you say is kind of, the reason why we should invest in our mental health?
Well, for one thing, mental health is so important that when we don't treat mental health, when there are blocks to access to care, especially for disadvantaged communities, minority communities, we find that they can have a much rougher time when they become depressed or go through anxiety or go through a stressful time. And it does affect a lot of things, their physical health, their community day-to-day life. So if we can intervene sooner and help, I think it can make a big, big difference.